after the end of first year. The child agreed to the condition and was sent away. During her stay at the hostel, she could not make any friends as she was highly introvert and as a result used to stay alone mostly. The food at the hostel was also not of a very good taste. So she started missing her meals. She also became conscious of her looks as she was overweight, and so she started voluntarily eating less to lose weight. Whenever her friends went home on weekends or their parents came to the hostel to see them, she would get very angry as nobody came to see her. She would remain in her room and close her fists tightly in anger as she could not express her anger anywhere. The mother of the child was concerned about her future and academics, and so she thought it is best to send her away from the stressful environment at home after the separation from the husband. The girl returned home after 1 year of stay at the hostel. She had lost 15 kgs weight as she missed most of her meals at the hostel. When she reached home, she found that the mother was not going to keep her at home and was planning to send her back to the hostel after a few days. She became infuriated at knowing that she toiled hard at the hostel to be able to come back home and stay with the family, but it was all in vain. And within a day, she started complaining of nausea, intense pain in the epigastrium. There was no overt display of anger, and instead she just secluded herself in a room and became quiet. See how quickly the nausea started developing, how the body reacts in an acute condition so quickly that you get the symptoms almost within the 24 hours of the intense emotion that is felt. She stopped talking much with the people in the house as she felt betrayed by her own family members who lied to her that they would get her back if she performed well. Patient stopped eating food in anger, and within few days her situation became serious as she was not able to pass stool and was vomiting many times a day, for which she had to be admitted in the hospital. How do we interpret this case? Nausea is a sign of suppressed anger, is a sign of disgust, repulsion. Vomiting is to give back, to throw out something that is not digested. It is anti-peristalsis, which means it is syphilis, as the food is not exiting from the proper channel. What is pain? Pain symbolizes a hurt at the emotional level. Whenever there is pain, it is a painful pathology. It shows that the person or the patient has been emotionally hurt. Stomach symbolizes self or the patient himself. And the patient had pain in the epigastrium, which means someone superior to self as it is located anatomically above. Bile symbolizes suppressed anger and embittered feeling. Intestinal obstruction, it is psychosis. It shows that the person is not willing to get rid of the indigestible morsel at the level of the mind. Patient going into acute renal failure. Kidney disease means there has been an abandonment or a feeling of a fish out of water. Retention of water. Body saves water for unfavorable circumstances that will aid in the existence. Retention of the products of protein breakdown. The uric acid increasing, the creatinine increases, the BUN increasing. The body is trying to compensate for the protein loss in the urine by accumulating the protein degradation products. ANA positive, though this is most important. When we have a sorosyphilitic case, that means when the sora has exaggerated and now the case is moving towards destruction, it gives rise to autoimmunity where there is imminent threat of destruction of life. The mind gives the body a signal to destroy itself and it leads to autoimmunity. It is better to give up on life rather than face the existing conflict. So, pseudosyphilis, when it gets exaggerated, leads to autoimmunity. In such pseudosyphilitic cases where the control of intellect is lost, the condition is of a delirium. The mind gives the signal to destroy. The body has to protect itself. The vital force has to protect itself. But instead, it goes into self destruction. That means that there is an aberration of the intellect, and this is a condition of delirium. Why a right-sided pleural effusion? Pleura is a protective covering. We have read about the attack conflict related to the pleura. So there has to be a perceived attack, a fear of an attack, which leads to pleural effusion. The right side, being the paternal side, is related to support, whereas the left side or the maternal side has to do with love and nutrition. The need of the child was support and protection from the family members. It wanted to be with the family but was sent away to the hostel. This is the reason why the pleural effusion developed on the right side. Also, as the parents were separated, the fatherly protection was absent in this case. So, whenever there is pleural effusion, what we have to inquire is a fear caused by attack to the existence. Case analysis. Body and mind both went into a delirious state. Okay, so this says that you will have to rejoin the meeting in 10 minutes. We will finish this case. After that, you can rejoin the meeting and we will carry forward from there. The body and mind both went into a delirious state. We must pick the syphilitic symptoms which are associated with the delirium. As vomiting was the only striking physical concomitant, I considered the rubric delirium vomiting with from complete repertory which has digitalis, dorifora, cecal cor and veratrum album. Now I was in constant touch with the mother and the aunt of the patient. I asked them to tell me anything peculiar about the way that the patient was behaving during the illness. Two important things were found. Firstly, the hand and feet of the patient were very cold to touch because of the repeated vomiting. And the patient wanted to remove the hospital gown from her abdomen as that aggravated her nausea. So, the modality of better by uncovering and cholera like symptoms with coldness went in favor of cecal cor. This patient was prescribed cecal cor 1 m and one drop was put in 100 ml water and application was done 3 hourly. As the patient was having a Rice tube, so we went for an external application. Follow up. Patient passed 1600 ml urine within 24 hours. Patient also passed stools within 24 hours. Rice tube was removed the next day and the patient regained an appetite and started oral feed. The most important thing in such cases of ICU admissions is that the patient should not be dependent on catheters and Rice tube or ventilator. The first Good prognostic marker will be the removal of these assistants. So BUN and creatinine level also started reducing. All physical signs and symptoms disappeared, and the patient was discharged after 3 days. GFR rose to 158 in 10 days. This is the report. We see here BUN 41 going to 17 from 2nd August to 5th August. Creatinine from 2nd August going to from 4.01 to 0.98, and the GFR increasing to 158. Aphorism 82. It says that in acute diseases, the chief symptoms strike us and become evident more quickly, and much less time is requisite for tracing the picture of disease, and much fewer questions are required to be asked, as everything is almost self evident. In aphorism 152, he says the worse of the acute disease is, of so much the more numerous and striking symptoms is it generally composed. But with so much the more certainty may a suitable remedy for it be found,